Mrs. Doe. My name is Yesenia. I'll be your nurse for today. Can you go ahead and verify your name and your date of birth, please? Okay, I'm gonna check your wristband. All right, that matches. So I'm coming in to do your trach care, which is gonna be removing some of the things you have on and then cleaning. How are you feeling right now? Yeah, I could hear a little bit of gurgling. I think you could benefit from some suctioning. I also see that your oxygen saturation is a little low, so I think we can go ahead and get some suctioning so you could breathe a little bit better. But let me go ahead and listen to your lung sounds so I can see what's going on, okay? Okay. Yeah, I could definitely hear a lot of secretions in there. So we'll go ahead and do some suctioning for you, okay, Mrs. Doe? Also, I know that throughout the procedure, you're gonna have a little bit of difficulty communicating with me. So if you want, we could just use a thumbs up for you're clear and ready to go. And we could keep going with the procedure, and then a thumbs down if you feel really uncomfortable and you want me to stop, okay? So feel free to let me know at any point if you feel uncomfortable and you need me to stop. Also, some questions I have to ask you are if you have any allergies. No allergies? Okay. Do you have any pain right now? No pain? Okay. And then do you have any questions or concerns before we get started? No? Okay. Well, I do want to let you know just a little bit of what the trach care instills. So, have you had this done before? No? Okay, well, I'll let you know what's gonna happen. So basically, I'm just gonna take out the inner cannula that you have on right now, and then we'll put on a clean, fresh one. Then I will remove the dressing that you have on, and then clean all around your skin in that area using some Q-tips and some gauze. And then I'll put a new dressing on. And then after that, I'll go get a nurse to come help me to change your trach ties, because that requires 2 people to be here. And this is gonna happen after I do your suctioning, okay? You have any questions? No? All right, so I'll go ahead and get started. I have to prepare my materials first, so just sit still for a few minutes while I do that. I'm gonna go ahead and clean the table first for 30 seconds. Okay, so now that that's clean, we're gonna go ahead and let it dry for a few minutes. And while I do that, I'm gonna make sure you have all your emergency equipment. So I see you have the 2 trach tubes. One is a size 8, which is the same one you have on now, and then you have a size 6, which is a little bit smaller. You have an extra inner cannula, and then let me go ahead and check your oxygen equipment. Your BVM is connected to high flow oxygen. And I'm just gonna make sure it works. Okay, it looks like that works. And then your oxygen mask is on the flow that it needs to be. I'm gonna go ahead and turn up the suction, make sure it's between 100 and 120. And then at this point is when I would go ahead and change out the suction catheter to a fresh new one. So now that I've changed it to a new one, it's ready to be used. So now I'm gonna go ahead, and since the table has now dried for 2 minutes, I'm gonna prepare my supplies on the table. And then I'll put on a face shield. Alright, so we'll do hand hygiene and put on some gloves. So I'm going to go ahead and take out the sterile gloves because I will not be needing those. And I'm going to be putting a little drape over you in case any water or anything spills on your chest. Okay. And I'll be taking out this sterile cup and placing it on the table. And since I don't need the suction catheter, I'm just going to go ahead and toss it out. I'm going to grab my sterile water. And I'm going to pour some into the sterile cup as well as the tray over here. Okay. Now that that's done, I'm going to remove my gloves. I'm going to prepare to give you some breaths with the BVM bag. That's just going to help your oxygen saturation to go up a little bit before we suction, okay? So I'm going to take off this mask. And then I'll go ahead and grab this BVM. And give 2 breaths. Okay, looks good. And it looks like your oxygen saturation went up a little bit with that, which is good, but we still need to suction. You're feeling okay, Mrs. Doe? All right, let me know if at any point you feel you need to stop. Okay, so I'm gonna go ahead and grab your suction catheter. I'm gonna make sure it works by dipping it in the water a little bit. Okay, looks like it works. So I'm going to just put the suction catheter down enough to make you cough a little bit. And then once you cough, I'll start pulling it out slowly. And it won't take more than 10 seconds, okay? Are you ready? All right. All right, we're all done with that. How do you feel, Mrs. Doe? You feel all right? Okay, it looks like your oxygen saturations went up to 98, so that's great. You feel like you need to be suctioned again, or do you feel okay? You feel okay? All right, so if you did need to be suctioned again, I'd have to wait 30 seconds, and then we'd repeat the process of hyperoxygenating, and then I could suction again. All right? So I'll put on your oxygen mask again while I prepare to do the next part, which is going to be doing the tracheostomy care, taking out the cannula. Okay, so now I'm going to go ahead and take out the cannula you have in now. Toss that away. Then I'll grab the new one. Go ahead and put it in. Okay. Do you feel okay, Mrs. Doe? You feel okay for me to continue? All right. So if you need your oxygen at any point, please let me know and we can give you your oxygen mask for a couple minutes so you can feel like you're not short of breath. All right. So I'm going to take off the dressing, throw it away, and then I'll assess the skin for any redness or swelling. I don't see any redness or swelling. The tube looks like it's in place and it's intact. The skin is intact and the tube is secured. So now I'm going to go ahead and start cleaning. So I'm going to take the gauze and dip it in the water, as well as the Q-tips. Okay, so I'm going to grab the Q-tips. I'm going to do one at the bottom, one at the top, and then we'll do one wet gauze at the bottom, one wet gauze at the top, and then I'll use this one just to clean the faceplate because it looks like you have some secretions on here. Okay. And then I'll use one more just to pat everything down. Alright. So that looks good. Then the last one that we saved is the split gauze, which is going to be your dressing. So I'm going to go ahead and put that underneath the faceplate. Let me just make sure it's nice and secured. Okay. All right. Do you feel okay, Mrs. Doe? Okay, we're gonna go ahead and put your oxygen back on. So now I'm gonna go get my other nurse to come and help me change your ties. So I'm gonna leave your bed in the lowest position and leave your call bell right here, okay? Hello, Mrs. Doe. I'm back with my colleague Clement, and he's gonna be helping me change your trach ties. Can you please confirm your name and date of birth before I get started? Okay, thank you. So we're gonna go ahead and perform hand hygiene and put some gloves on. I'm going to take your oxygen off. Okay, and then my partner is going to help me stabilize the faceplate while I take off one side. Okay, then I'll pass this to him and I'll stabilize it. Okay, so now I'm going to go grab the new ones. And I'll start by putting it on this side. pass it to my partner. Okay, all done, and we're just gonna make sure that there's 2 finger space within that. Does that feel okay, Miss Doe? It does? Okay, great. Let me put your oxygen back on. All right. So we're all done with the tracheostomy care. I'm gonna go ahead and throw everything away. Okay, Miss Doe, last thing I have to do is just check your lung sounds very quickly. And I did check your skin underneath your neck. I'm gonna go ahead and document that once I go document the procedure, okay? But everything looks good. There's no skin breakdown. Okay, so I'm gonna check your lung sounds one last time. All right, sounds much better, Miss Doe. If at any point you need me to suction you again, please let me know. Okay, so I'm gonna go ahead and leave your bed in the lowest position and give you your call light. I did leave a fresh suction catheter in case the next nurse asks you. That one is brand new, okay? All right, thank you, Miss Doe. So now I'm gonna go ahead and document on my computer the procedure. I'm gonna document that the patient tolerated the procedure well. She had no complaints and she was not in any pain. The patient respiratory assessment was documented as well. I'm going to document the sputum amount and color, and I'm also going to document that the patient SpO2 levels increased with suctioning. I'm going to go ahead and also document the rest of the vital signs, which I did at the beginning of the assessment, as well as the lung sounds. I'm going to document the neck assessment. The skin was intact. There's no skin breakdown, as well as the tracheostomy stoma assessment. I'm going to document that there was no redness or swelling in the stoma and that the tracheostomy is secured.